Hi team. Today, we're going to discuss an important topic that concerns our safety when working with low-speed electrical buffers in the aged care sector. We'll be focusing on risk assessment and how it plays a vital role in keeping us and the residents protected during our tasks. By identifying and understanding potential risks, we can take appropriate measures to prevent accidents and injuries. Firstly, let's clarify what we mean by risk assessment. Risk assessment is a systematic process of identifying hazards, evaluating their potential consequences, and implementing measures to control or mitigate those risks. It involves assessing the likelihood of an incident occurring and the severity of its impact. Now, let's identify some potential hazards associated with low-speed electrical buffers in the aged care sector. Resident safety. The presence of vulnerable residents increases the risk of accidents and injuries. They may have mobility issues, cognitive impairments, or sensory limitations, making them more susceptible to accidents during buffer operation. Electrical hazards. The use of electrical equipment poses a risk of electrical shocks or short circuits if not handled properly. Faulty wiring, damaged cords, or improper grounding can lead to these hazards. Mechanical hazards. The rotating buffer pad can cause entanglement or entrapment of fingers, loose clothing, or items used by residents. There's also a risk of flying debris or objects if the buffer is used incorrectly or with damaged parts. Chemical hazards. Depending on the task, there may be chemicals involved, such as cleaning agents or solvents. These substances can pose risks if they come into contact with the skin or are inhaled, particularly for residents with sensitivities or allergies. Let's discuss some preventive measures we can take to reduce the risks associated with using low-speed electrical buffers in the aged care sector. Resident-centered approach. Prioritize resident safety and well-being at all times. Consider their individual needs and limitations when planning buffer tasks. Communicate and collaborate with residents and their families to address any concerns or potential risks. Staff training and competence. Ensure that all staff members receive comprehensive training on the safe operation of low-speed electrical buffers, including the unique considerations of working in the aged care sector. Continuously assess staff competence and provide ongoing training and refresher courses. Environmental precautions. Clear the area where the buffer will be used from any obstacles or potential tripping hazards. Ensure that cords and cables are properly managed and out of the way to prevent accidents. Resident accessibility. Consider the mobility and accessibility needs of residents when planning buffer tasks. Make sure that residents can move safely and comfortably in the environment during buffer operation. Personal protective equipment, PPE. Provide appropriate PPE to staff members involved in buffer tasks, including safety glasses, gloves, and, if necessary, respiratory protection. Train staff on the proper use and disposal of PPE. Regular maintenance and inspections. Regularly inspect the electrical buffer for any defects and promptly report any issues to the maintenance team. Follow the manufacturer's guidelines for maintenance and ensure that the buffer is in good working condition. In conclusion, conducting a thorough risk assessment and implementing preventive measures are crucial when working with low-speed electrical buffers in the aged care sector. By identifying potential hazards, evaluating risks, and taking appropriate measures, we can create a safer environment for both staff and residents. Remember to prioritize resident safety, involve residents and staff in the process, and continually review and update the risk assessment as needed. Together, let's ensure the well-being of everyone involved in operating low-speed electrical buffers in the aged care sector. Let's prioritize safety in everything we do.